It doesn't matter whether you're going to go to the hospital or you're going to do it at home. If you're going to have a midwife or you're going to have an OB, you can be autonomous in your experience and you can achieve a beautiful, centered experience for yourself. And you don't have to think that means you can't have that because you don't have money.
What's up, y'all? It's Ashley.
It's Melody.
And Cody here. And you've tapped into
The Mama's Den.
Welcome, welcome, welcome to the
Mama's Den podcast.
Yes.
Wow. That has stuck.
Yeah.
After all this time.
What's stuck is that I'm not singing and now you are.
You're very good at directing.
I do what I can.
Yes,
And I'm very good at singing, so I'll join in.
Yes, exactly.
We're all playing our part. You are good at singing. You're good at rapping, homie. Got these bars like Doug.
So Mama's Den fam, we got a special one for you today. We're going to talk about birth, y'all.
Birth.
Okay?
The reason and the way we all got here.
The way we all
Birth.
got here in life and on the Mama's Den. So I am Cody Lane Oliver. I have 3 children. I have twins who are 7 years old and a 9-year-old. All boys born here in California.
I am Melanie Fiona. I have 2 children. Cameron, who is 10, which is crazy, he just turned 10, and Kaya, who's 4, and they were also both born in California. Shout out to Santa Monica babies.
I am Ashley Chia. I have 4 daughters. Amira was born in Columbus, Ohio, like me and her father. We were all born on a Thursday.
Oh, wow.
And she is 17. And then Zara, who's 9, she's born in Anaheim. Asia was born in Anaheim. She's 7. And Natalia is my only official LA baby. She was born at Cedars.
Boom.
Oh, wow.
She's 4.
Okay,
She is
so
4.
for our YouTube audience, you know that we have 2 special guests here in the den. For our audio audience, hang on to your shirts. No, I'm just kidding. So we have 2 doulas that are going to introduce themselves, but I would just want to share that Khefri, one of our doulas that's here today, actually taught a prenatal yoga class that I went to when I was pregnant with Brooks.
Wow.
That ultimately led me to finding my midwife, Kim, through Khefri. And so I'm just so excited to be reunited in this way.
Aww.
And for you guys to tell us a little bit more about yourselves and how we can help our mamas out here.
Om Goddess.
Yes. Om Goddess. It's a good way to start a conversation.
Who's first?
Yes.
Khefri?
What are we talking about again?
Say your
Tell us about
name.
yourself.
Where you
Yes.
from? Rep your set. You
That's
know.
right. My name is Khefri Riley. I'm definitely a West Coast lady. If you're from LA, Crenshaw and Pico, the cross streets where I'm from. So it's really important to know where you're from, what blocks you're from. I also gave birth on Medi-Cal. I have a son who's 24. I gave birth at the Beverly Birth Center off of Western and Beverly. That was on Medi-Cal, and that was a water birth on Medi-Cal.
Oh.
And that moment was a very transformative moment in my life. It was literally the moment that you say, okay, I'm here to have something different happen in my life and for others that are around me in my community. I felt an immediate connection to a powerful, what I call God force activation is the only way I could say it. Because you know, when you're crowning and the baby's coming out, there's no turning back.
Yes.
Something is in store for you, something really amazing. And I think that if I look back those 24 years ago, that's how we got here today. And we're going to talk a little bit about doulas and the powerful work of doulas and birth workers and the advocacy that's being done in California and across the United States. And I'm a doula, I'm a maternal health advocate, I'm a yoga teacher, educator, trainer, and I'm really honored to be here.
Oh, wow.
Thank you. Beautiful.
That was beautiful.
Such a
Peaceful voice.
Right?
Yoga teacher.
Yes.
Doula.
I am Sayida Peprah-Wilson. I am a mother of 2. I had both of my daughters while I was on Medi-Cal as well. One of them in a hospital and the other one at home, both with midwives. So had CNMs for the first one and LM, CPM for those that know all the midwifery acronyms in the street, community home birth midwives at home. My oldest is Aquia. She's now 18. And my youngest is Inyame, who is 15.
Oh, wow.
I'm a psychologist as well. So in the world, I'm known as Dr. Sayida all
Dr.
the time.
Sayida.
And I am also a doula. And that came from my own internal, I think Khefri also mentioned that spiritual connection. I always felt connected to birth. And when my teenage bestie in high school got pregnant, I was her doula without even knowing what a doula was. I was like, I have to be there. I'll help you breastfeed. I mean, I was 17. I don't know why I felt that I knew, but I did. I felt that inner knowing. And after that, people in my family and friends knew that if you have a baby, you should call Sayida. She's going to come. Wow. So from my teenage years, I've been attending birth with my family members and friends and community, just as the person you call. And then when I had my baby at 24, I didn't know anything about like the word doula, but somebody had mentioned, I think you should have a doula, because I was looking for a natural birth and I didn't have enough money to have a home birth at that time. I didn't know anything. I'm from Jersey originally. You could tell from the accent probably. So I was here in grad school. I didn't know anything about the ecosystem for healthcare. I didn't have insurance. And back then, unlike now, it was a pre-existing condition to be pregnant. So you couldn't get insurance. You could only get Medi-Cal before Obamacare.
Yeah.
And so I had no choice but to have Medi-Cal, which was scary because I was like, I'm gonna get the government's insurance. This is gonna be the worst.
We were like the only people birthing on Medi-Cal. You think you're alone.
I was
You're
like,
not alone.
what's gonna happen? Where do I go? And so I started off at a bunch of like local clinics at Planned Parenthood. I was like, I know Planned Parenthood because I remember that from youth. And eventually somebody mentioned I should have a doula. I got a doula, a Black doula, Angela Brown, who's in Los Angeles. And she just was amazing. And I was like, oh, I've been doing this my whole life. This is what I am. And I was in school to be a psychologist, but I was like, I'm a doula. So I went and got certified and trained as a doula and started doulaing while I was in grad school and continued to doula since then all along.
How did you two find each other?
Wow. That's interesting because we were brought together when we were both hired as supervisors to be supervisors for the very first Los Angeles County, and indeed one of the first in California, community doula pilots that was funded by HealthNet. And we had already met each other. I think there was like some ceremony that was taking place with one of our friends.
Yeah, that we were at, like, oh,
yeah, yes. We were doing stuff. It was something beautiful. Anyway, then that's how we really connected and realized that that we were here to make some serious change happen in the communities and through birth work. And we both realized that we had that radical approach to how we can transform lives through the humanitarian ways that birth is connecting all of us. And I think that there's a lot happening right now in the world. There always has been. It's just a cycle. And it's very fear-based. A lot's happening. And that means that people who are pregnant are going to be very afraid. And also with the statistics that are out there, there's a lot of fear. And we don't operate in fear. We operate out of clarity and peace and true focus on what we can achieve together. We just had so much in common, and we knew the mission that we had to.
We also, because we both had birthed on Medi-Cal, and we both had a similar, like, we figured out how to have this radical, beautiful, self-empowered experience with very little resources.
Yeah, on the government program at the point.
So
at that point, there was stigma.
We strategized that. So we were like, we should teach people how to utilize the resources and have that level of self-empowerment in your own experience. Like, it doesn't matter whether you're going to go to the hospital or you're going to do it at home. If you're going to have a midwife or you're going to have an OB, you can be autonomous in your experience and you can achieve a beautiful, centered experience for yourself. And you don't have to think that means you can't have that because you don't have money. Because, you know, back in the day, before the Medi-Cal doula benefit was created, the only way you got a doula was if you had money.
It was considered a luxury item and achieved only to those in the upper classes, the upper castes. And actually, the doula benefit and doulas in general, birth workers in general, are part of an absolutely traditional indigenous practice. My great-grandmother's grandmothers were all baby and birth care workers in Greenville, South Carolina. They were African indigenous midwives. And that is the lineage that we continue. And that's where everybody has that right to have a doula, a birth worker, and a powerful part of the community by their side if they choose.
I have a question, Ashley here. So I had my first daughter in Columbus, Ohio, and we have what's called CareSource, which is essentially, they may have changed their name now, but it was called CareSource 17 years ago, and it's government insurance. So I wasn't married to, I'm married to my husband now, but we weren't married when I had her. And so I couldn't be on his insurance and I had to be on that. And I would say a good experience in the sense that, well, first of all, I was living in New York dancing, so I didn't move back to Columbus until I was 6 months pregnant. So when you said pre-existing condition, the only option for me was to have care. So I didn't have any prenatal care prior to that. I think I was just going with the vibes. And then when I got to Columbus, I actually almost could not go see anyone because after a certain point, people won't take you for prenatal care. Yeah, they're like, I don't want to, that liability. So there's a hospital in Columbus called Grant Hospital, and it's a trauma hospital. And their like maternity ward was so old because it's where everyone goes for like gunshot wounds. So that's what they focus on. But they have like across the street, a clinic, and that's where you go if you have the government insurance, and you see a different doctor every single time. It's not like the personal experience. You just go in, whoever's there is there. You go and they're just like, how do you feel? And you're like, I don't know. And they're like, great, see you in 6 more weeks. But I will say the experience for me was I didn't have to pay a dime. I had the baby. There was no bill. I don't remember my doctor's name because it wasn't even any of the doctors that I saw, but she was actually really amazing. The nurses were amazing. And then what I noticed is that they have all these programs. And so when I went home, they sent someone to my house to check up on me. They bring you all of this stuff. And I was like, I'm breastfeeding, but they still will bring you formula anyway. And they bring you, yes, they did home visits. And that was like my first real understanding of that, you know, like, because none of my friends were pregnant. And, you know, the stories that you hear from your elders are like completely different. Right. Oh, I had you in a barn. Like, okay, girl.
We're not doing that.
Right, relax. Everything's fine. So that was like my first understanding of that. So I was going to ask both of you, when you both had doulas, did someone tell you that that program existed? Like, how did you discover that that program existed and to know to seek a doula?
Well, in my case, they were throwing a baby shower for me, like people in my spiritual community. And one of the women in our community is a doula. And people, the elders, like they knew that. Okay. So they were like, based on your vibe and your whole natural thing, you're trying to, you should have a doula. And so then they just connected me and they paid for it through my baby shower. Oh, wow. So I wouldn't have been able to afford that, you know, on my own. Okay. And so that's the other thing too. Like this part of Medi-Cal and the government picking up doula is amazing because otherwise you'd have to pay for it. And then it's not achievable for people who really also deserve to have, you know, intimate support. And
so it wasn't covered when you first had your child, but covered. It is now.
It is now. Okay. Correct.
And it's been that way since 2023. Is this correct?
Yes.
Yeah.
Okay. So can you share with our audience, Khefri and Sayida, how do women start? Like if they're like, I'm pregnant, I need these services, I would like to, educate myself on these services. Where do you begin? Where does one begin?
I think the journey always begins with oneself first. And I really want to bring it back to the attention of the audience and to us here on this couch that birth is an inside job. Right. And we want to take Medi-Cal or Medicaid from stigma into sovereignty, meaning you have the choice to bring in whoever you want as a care provider, as a midwife, as a doctor, as a doula, a family member. You get to choose who's there in community when you're giving birth and in your postpartum experience. And so the Medi-Cal doula benefit in California, and indeed there are many states throughout the United States that have Medicaid doula benefits. And so people need to contact their managed care plans or their health plans to find out if they have a doula benefit and then to ask for referrals for those who are local. Also the community-based organizations that are there that are in the community that are reflecting you and community are the ones that can connect you to doula care. In California, we have the California Black Doula Directory. We have the LADoulahub.com that connect you to your managed care plan, and you can find doulas that work for you. I think that you really have to know what you're wanting and what you want to achieve and what you want to desire. And when I ask clients, like, what do you desire for your birth? They're like, I haven't even thought of that.
Right.
You know, because there's so much shame around like even us having a choice or raising our voice to tell the doctor, the midwife, this is what I'd like. You know, even when you say, I want to get on my hands and knees, and they say, no, you've got to stay there. No, you don't. Yeah.
You know, I'll say that. I'll say through my own experience. So with my son, this is Melanie, with my son Cameron, I had a doula and I went through an interview process with a doula. And I interviewed 3 doulas till I think I found who it was. And that was really important in the search, right? Is to interview people and to really sit and be like, am I aligned? Do I feel supported by this person? Do I feel like they understand who I am? And I did with my doula. The second, my second birth, I didn't have a doula, but I had a black OBGYN. I had a doctor, and she was, I mean, she might as well be all of the things because the way she practices, even though she practices in hospital, I know the entire doula community loved her and they're like, we want her to come over to our side so we can get her to do home births and things like that. But she came and did all my home visits. She came to my house. I never had to go see her in an office. And when I told her that I wanted to birth on my hands and knees, I was like, what if she was like, I'm your doctor. She says, you can birth however you feel comfortable. Unfortunately, I ended up having to have a C-section because I had developed placenta previa in my 3rd trimester.
Hence the importance for medical care.
Right. Because if you didn't know that and you were trying to go on your own.
Correct.
Then,
Correct. And so I remember I called her in that moment when I found out from the scan, and when she came over for my next appointment, we sat and spoke for 30 minutes. And she just said, talk to me what you're feeling. Because I was very, very devastated. I was so sad. And she was like, you're still in my care.
Yeah.
I will take great care of you. Like what we have, I will also take you through. So she ended up calling in another surgeon for the doctor. For the procedure, who was also very highly renowned and people loved and trusted. And he was very well experienced. And so she brought him in as her number 2, which was like, this is somebody who cares. And so I say all that to say, you know, it is a very important person. And I went through 3 doctors before I found her on that second pregnancy. So the process of finding people who are aligned, asking yourself what it is that you want, not settling
Right.
for something that you don't feel sure about,
Right.
because there are options out there
There
to
are.
support you getting the desired birth that you need.
Absolutely.
And
Which
that
is so
said,
important.
like that's what we're not even midway through, but that's what I'm hoping that our audience really takes away from this entire conversation, because we are going to be talking about specifically doula care in California and some of the data. But the reality is, like, we want everybody to know that you have options.
Mhm.
You have to do your research.
Right.
You have to try to remove fear. But also, like, if you're not trying to have a baby and you're listening to this episode and you are somebody's husband, partner, sister, cousin, mama, like, let this help you help them.
Yes,
We
share
want
the info.
Birthing
Well, community
people to
care
feel
is
empowered.
medicine.
Yeah.
Community care is medicine. I think that sometimes we want to look outside of ourselves for the answer. We want to look outside ourselves for somebody to save us.
Yeah.
But you have to make the decision of what you're wanting, and you have to trust in your body and
Yeah.
trust in the natural process, and also that you deserve the care. You deserve correct care. You deserve culturally amplified care. And I want to make a point about what you just said, because most likely you had really great insurance and you're able to have some choices, but the folks and families that are on Medicaid or Medi-Cal in California may not see themselves as having those choices.
Right.
And so I think that you have to really step into your autonomy and,
Yes.
and really vocalize what you're wanting, what you're needing, and don't be afraid to change providers. And doulas can do that with you. They can support you in your choices. And that's the number one benefit of doulas, is that they basically stand in a space for you to amplify what you're wanting,
Yeah.
to respect your wishes, and to kind of guide you and help you co-create the birth experience that you want.
Mm-hmm.
I want to jump into a few anchor points, y'all.
Sure.
So just bear with me for a second. Just FYI for everyone, in California, 40% of births are covered by Medi-Cal, which is quite a lot. Doula care became a covered Medi-Cal benefit in 2023. And doula support is associated with, of course, lower cesarean rates, fewer complications, and improved breastfeeding outcomes. 66% of Black women in California say they would want or consider a doula. So I want to ask you guys, what does the Medi-Cal doula support cover? Because I know there's a lot of different kinds of doulas. Does it cover everybody?
Well, it's interesting. So it covers anyone that's pregnant. And
Okay.
you said something that I want to clarify, because you said, well, like, if you're going to have a baby, blah, 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 get your support. But actually, even if you don't want to have a baby, right? So if you decided you have a medical reason or personal reason why you're going to terminate pregnancy, you can have a doula, because the doula benefit is tied to pregnancy and not to a birth outcome. It was very important when it was built. And Khefri and I and a number of other really powerful Black birth workers around California helped DHCS build the Medi-Cal doula benefit. We have been in the work, and we have been at the stage with them to make sure that the way that it was built out would make sense for all the people. And we're like, all the people who need it aren't just people who are planning to have a baby, because we have, as doulas, supported people who are terminating pregnancy because people call us, right? Doulas end up being the people who get called. I'm going to say a shout out to Frontline Doula Hotline, because we also, Khefri and I co-founded something called the Frontline Doula Hotline. And one of the reasons why it started is because doulas are always getting called. And during the pandemic, so many people were calling the doulas trying to find out, what do I do? I'm not able to go to the hospital. They said that I have to wait. Back then, they wanted you to be with almost a head coming out before you get in the hospital. So then people were at home laboring, and they never even had a plan for that, right?
Yeah.
And then some people weren't even able to get into visits, to the point that was spoken earlier. All that to say, you could be ready to terminate an abortion. To have an abortion or terminate pregnancy. You could be having a miscarriage if you have a stillbirth. So some of the benefits, like if it was tied to a live birth outcome, what if you don't have a live birth outcome? What if you have a miscarriage partway in? And also, as far as like the reimbursement fee, it's based on fee for service. So you don't have to have one outcome and then you get all of your money.
Yeah.
For everything that you do, you can be paid for it.
If I'm in the middle of a pregnancy and finding out that, something, I have to terminate the pregnancy, like, when can you get that benefit?
You can get the benefit as soon as you are pregnant. So the Medi-Cal doula benefit in California covers the entire year of your pregnancy. It covers anything that's happening up until the baby is born. And so that includes miscarriage, abortion, and stillbirth. Then it covers the day of your birth. Then it covers the year after, the entire postpartum year.
Hello, postpartum doula.
Oh, that's right. That's
What?
right.
So if
Yeah.
you find out, so I met the lady who was cleaning in my house the other day. She was like, I'm 4 months postpartum. And I was telling her about the house, because she's like, you got all this baby stuff everywhere. I was like, yeah, we run a nonprofit and birth workers and doula. I wish I had a doula. I said, you could have a doula right now. Are you on Medi-Cal? She was on Medi-Cal. I was like, girl, call your Medicare plan and tell them I want a doula. And you can have a doula support you for the rest of this way.
Yeah.
Right. So it's amazing. It actually is amazing.
Can we also talk about what that looks like too? Because I think people don't necessarily understand postpartum care with a doula. What does that look like?
I know you postpartum a lot, so you take that one.
Oh, well, postpartum
For a year,
care,
especially.
Oh, yeah.
Yes.
We are
Because I'm like, how long does it go? I got a 4-year-old because I still need help
You're
after this.
postpartum for life.
Yeah,
That's what
exactly.
a lot of people say.
Postpartum for life. Once you give birth, then you are postpartum, meaning after the birth. And postpartum covered by the Medi-Cal Doula benefit is in the 12 months following the birth. And all of that actually was advocated for from our amazing colleagues and ourselves. And when we were writing the benefit, we wrote into legislature. We're so proud of that fact. And it's a historical benefit. It's absolutely historical. Nothing like this has been available to California birthing families. And so, and also we kind of have inspiration from other states, and we're hoping that other states glean information and inspiration from what we did here in California.
And if you're listening and you're in another state, you can advocate for some of the things that we're talking
Absolutely.
about.
Can you shout out just maybe a few states that are that
have a Medicaid doula benefit?
right, or that you feel inspired by, like you said, we're working.
Well, it's interesting. Some of the inspiration was things that they did wrong and it didn't work.
Yeah, that's it.
Frankly,
No, and they share their learnings.
Like who are on the ground like us. We talked across the country when these things were being built out because it was exciting. Like Medicaid is going to cover it in New York. Let's get in that conversation.
Yes.
And then it's like, oh wow, okay, let's see. Jersey's doing it. Rhode Island's done it. You know, a bunch of states. Portland has it. Oregon. But we wanted to see. So some of them they were very low rates. But in California, I mean, we have a different life. What do you call it? How much it costs to live.
Cost of living.
Cost of living.
Yeah.
We have a different cost of living in California than other places. So when
Yeah.
they tried to build our benefit, they based it on a state that had something around $450 for the whole birth support.
And honey, didn't value what caregivers do. And we
No.
basically elevated the work of caregivers, period, here. Women and caregivers deserve to be paid an equitable living wage.
Yes.
And it was very important. We had to go to bat. Oh, man, it was a war. And that's what we like to call it because we won, basically.
Yes.
And they increased the rate of reimbursement for caregivers that decide to become part of this benefit. And going back to your point about postpartum is one of the most important, most sacred points of a person who's given birth. It's one of the ways that you basically recover your energy. You have to pay attention to your nutrition. You're looking at the bonding of yourself as a new family unit, the bonding with your child. And there's a delicate balance. Also, your mental health states are really at risk at that point. And so the postpartum doula comes into the home and supports you with how you choose to feed your infant, whether that's breast or chest feeding, or if there's need to use bottle feeding. There's ways how you're recovering, whether you've had a cesarean birth or a vaginal birth. They're going to support you in that. Also, the social emotional support that a doula gives you is unprecedented. These are community doulas, so they're going to connect you to community resources, like you mentioned. How they all of a sudden you had all these things that are available to you. Actually, state-run programs have a lot of things. We just don't know how to tap into that.
Right.
So the community doula is going to help you tap into that. They're also going to really appreciate the physical changes that you're going through because we want to pretend like we could just get up and go, but actually we have to really nourish ourselves, pay attention to the new family unit, and a postpartum doula is going to bring that to you.
Do you ever do yoga with your postpartum clients?
Absolutely.
Oh, man.
After you've
God bless
recovered,
them.
after
Lucky
40 days
them.
recovery, then you can come back and do gentle yoga. You can do movement. You can do exercise. You can walk. You can be alive. You can dance. You can sing. You can pray. You can do all the things. But really what you have to do is rest and find some type of sanctuary in yourself so you can focus on your recovery and on your baby and on your new family unit.
Yeah.
And I just don't want to paint that romantically, though. I know that the most deserved families, the ones that are in the most, I would say, over-policed, oppressed, the states that need the most care, a community doula is going to come in and help you access resources. They're going to see you, they're going to feel you, and they're going to really be there for you. And I think that's why this is so radical, okay? Because we could sit up here in like a kind of a privileged space of how fantastic it is, and we could get a doula, you can afford it if you want, but those who cannot afford a doula, this makes it possible for you.
So
Yes.
I'm glad that you said that because I was actually going to ask you, it's more of a two-part question. Do you know what the qualifications are to have this coverage? Because what I often find is, believe it or not, it's actually the people in the middle.
Yes.
Because, and that's what I was going to say is
Financially.
that financially, people in the middle financially, because when I had my first child, I really have much of an income, and my husband couldn't, like I said, put me on his insurance because we weren't married at the time. So it was covered, right? Because I fell below a certain bracket. But then when we got married, I felt like that is actually when the struggle began because yes, he put me on his insurance, but then the deductible was super high. And there was a lot of stuff that we just could not afford, you
Absolutely.
know? And so I was almost like, well, we should get
Oh, yeah.
unmarried, child.
Right.
This does not benefit me as a woman.
Right.
But that's also within the system.
Yeah,
that's another conversation for another day.
It's a real
Right.
conversation.
That's the
Yeah.
conversation.
Yeah.
But so I feel like I was going to ask you, what do you suggest or how, because I had a friend who lost a baby and I actually paid for her to use, I didn't have a doula until my last child and I got a postpartum doula.
Mm-hmm.
And so I paid my postpartum doula to help her because we were
Beautiful.
pregnant at the same time and she lost her baby
Yeah.
while I still had mine and I
Yeah.
felt terrible.
Yeah.
And so while I was pregnant, I hired my who was going to be my postpartum doula to help her. Because I paid out of the pocket, I was like, oh my God, you
Yeah.
know? How do you suggest people in the middle who are caught in the middle
Yeah.
getting that support?
Well, a couple ways. One, the what is it? HSA and FHA, FSA. Those accounts can be helpful. I know that a lot of people strategize around like sort of saving
That's
into
what
those
we
health
did.
savings plans and then using that to pay. The other thing is the general insurance companies, you know, if you get something passed through the government insurance, it tends to influence mainstream insurance too.
Okay.
And in this case, we're really happy about that because mainstream insurance in California is following suit and also starting to cover doulas.
Okay.
So I think we will see that in the next 5-10 years, all the insurance plans are going to be covering doulas. I mean, maybe even less than, 5 years. So that's an option. Just get to your healthcare, health plan and find out if they're in the midst of that and if there's an opportunity for them to support that because some of them are building that. And I guess if they know that people want it, they will start moving on that faster. Baby showers, like I said, what they did for me, list that in your baby shower. I want a doula. It's going to cost me $3,000, $1,500, whatever it is.
Yeah.
And ask people to, to invest. Like, I do
Contribute,
think that it's something that we have to invest in, even when and not like we have to, but I wanted an autonomous experience. And so when I decided to have a home birth for the second one, I also was still on Medi-Cal. Medi-Cal does not cover a home birth. So what I did was I found a midwife that would work with me with payments. And I put the whole thing on a credit card because I was like, at the end of the day, what other things have I put on a credit card? I want a certain kind of experience. And I've already been through a birth and I really want to be at home. I want to go to sleep when this is over.
Yeah.
I want to have all the people that I want to be here to support me, to come and feed me. I don't want them to have to go and do security and they can only see me at a certain time and they're going to harass me about the blood pressure. I want to be comfortable.
Gosh.
Yeah.
And I had no money.
Yeah.
But I figured it out. So, and now that there are more opportunities to have that, it is about that kind of strategizing, and doulas can help you figure that out. And now you can have a doula for free to help you figure that out.
Yeah, but I have to keep it 100 with y'all. We are in a capitalistic society. You do not need the $500 stroller, and you do not need all the playpens, and you do not need all those things.
100%, yeah.
Quite frankly,
Those
the
were
green
things I
cycle,
sacrificed to
everything.
have a
Yes,
home birth.
exactly. So if you wanted to hire a doula, you definitely could prioritize that. Do you want a big fancy baby shower? Okay. Or do you want somebody who's going to help support you, protect you, and guide you? Also, we have to remember this. It does not take a system to basically return the power back to a traditional practice.
Right.
Okay, so my best friend Ada was my doula. My sister was my doula.
Yeah, and my
Literally.
friend was my doula the second time. I didn't have a formal doula.
Correct. Like a doula basically is somebody who's there to support you. What do doulas do? They offer social emotional support. They offer comfort. They offer care. They offer safety. That's what can change a birth outcome, and that's where the evidence lies for doula care. And so this Medi-Cal doula benefit basically represents a very traditional indigenous practice that is basically fundamental to Black communities, indigenous communities, and it's fundamental right now. You just have to reclaim it.
Yeah.
So it doesn't cost anything to do that.
So will you explain the Medi-Cal Doula Hub and how someone accesses it?
Right. The Los Angeles County Medi-Cal Doula Hub, you can go to ladoulahub.com. And if you're a family, you can go on there to the families page and find connections to your managed care plans. You can contact your managed care plans and request a doula. You can go to CaliforniaBlackDoulaDirectory.com and find a doula there if you're looking for a doula in California, but also all across the United States, doulas are there. If you're a doula, the LA County Medi-Cal Doula Hub helps connect you to technical resources and training, all the support that you need to become a Medi-Cal doula, helping you with workforce development as in your journey in treating families that are on Medi-Cal. And so you can come in there and find all of our calendar and list of events and sign up for events and come be in community with us.
You all mentioned earlier the Frontline Doula
Hotline.
That started in the pandemic. Can you say more about that? Because it sounds like anybody can call at
Oh,
any
anybody
time.
across the United States.
What's the number?
FrontlineDoulaHotline.com.
Yes.
FrontlineDoulaHotline.com, and that's how you book your no-cost call with the doula. And you're going to get doula care from the doulas on that hotline, and that's the United States and the world. I mean,
And you
people can
created
contact
it.
anywhere.
We did.
Oh, yeah.
That's
We founded that
amazing.
in a response to the Black Maternal Health crisis, in response to we had me and Sayida were fielding calls like we were emergency 101, honey,
Right.
from all our Black mama friends and there were actually some very serious things that were happening. They weren't to be taken lightly. People were having hemorrhages and their doctors weren't listening to them. They were having maternal health crises, mental health crises, and people weren't, centering them on what their experience could be and also connecting them to appropriate resources. And so we're like fielding all these calls. And so we said, we need a hotline for this.
Yeah.
And so that's how we created this free telehealth service for Black families.
How do we support that telehealth service? Because I assume you have people on staff that are answering
We
these
do.
calls.
Donation
There
only.
you go.
Donations.
Yes.
Do we go to the website?
Yep.
Frontlinedoulas.com/donate is where you can donate to that. And also organizations can continue to support this work.
Okay.
That the doula work and the midwifery work needs support here. And so organizations in California across the United States must have support with infrastructure, with capacity building. And like you said, how else can we continue to deliver these services in an equitable way unless we have the support from our funders and from the community?
Yeah.
So listen, after all of this, I don't think anyone would be on the fence about using a doula, but
No.
just in case, right?
Right.
If anybody is on the fence about it, and what is something that you wish they understood or an experience that one of you has had that you were like, I know this was the make or break difference?
Yeah, I think people think that having a doula, because especially in California, we've had doulas here for 30, 40 years in California, mostly serving white and upper middle class families in Beverly Hills and in, San Francisco and all the places where people have had doulas. So people in the community, people who couldn't otherwise afford a doula or don't have a lot of doulas in their community, think that you have to have money to have a doula. You have to want a natural birth to have a doula. Doulas have always supported people in any type of birth that they want to have and that they're going to have, because you might want to have one experience and you end up having another, which is the nature of the initiation of birth. So, but in the Medi-Cal doula benefit in particular, these doulas are ready to serve at whatever level, right? We're talking about whether you intend to have a baby or not, whether you have the ideal circumstances, because financially people, if you have Medi-Cal, you might also have other social determinants issues that come up in your life. You might have financial things. You might have instability with housing. You might have domestic violence. You might be parenting by yourself. So, there is an opportunity for doulas to support at a level that I think people don't realize. So if you want to have a epidural, you can have a doula. A doula can support you. Listen, how many times have you supported people? Yeah, we had a doula once in one of our programs where the doctors were like, no doula, you can't come in to do the epidural. And the client was freaking out so badly that they went back and said, oh, I'm so sorry. Could you come back from the waiting room because we need you? Because she was calm. And then you left and she started freaking out. And it's like, well, of course, she knows me. She don't know y'all. To your point, I just met you just now.
Right.
You about to put something in my back that could, whatever people's fears are about it. She was keeping me calm, holding my hand. She's been with me since before we got here, and she's coming home with me.
Yeah.
And you want me to leave her, and I'm by myself. Like, why would you think I could do that? So I don't want people to think they have to birth alone. I don't want people to think they have to do any of this process. It's not the nature of giving birth on this planet to do it in isolation. We are communal people, and we've always had community support, and you could get to have that.
I saw something earlier on, Sayida. It was a social media post. I don't know if you guys had come across it. Maybe you did, because they probably knew that y'all were coming. Yes, where this woman had her two doulas or birth workers in the room with her, and they called officers to remove them. Now, can we talk about that just for a quick second?
Sure.
Can they legally do this?
The legal part is interesting. According to human rights in childbirth, according to actual international rights that people have, you should be able to have a right to have the people in the room that you want to have. But when you give your care to a hospital, as in you say, I am your patient, people don't realize it's a transaction. You sign those papers, you're saying that I'm giving you the power to have influence over my care, that I'm trusting you. And they are supposed to continue to give you informed consent. They're supposed to make sure that you have autonomy. But that is not how these systems were built. These systems were built where people were chained up and be put to sleep. I mean, think of historical childbirth. These same systems are just, it's the same sort of like background behind it. And now we have new laws that have come, but has informed consent really changed that much since informed consent laws have come on? Do people really feel like they understand? So is a person supposed to have the right to have a person with them? Yes. But can a hospital say that they have determined that they think this is a security risk, and somebody's been given power to say what a security risk is, and quote unquote throw your doula or your husband out who's concerned for your life, right? In a moment of birth, so I've seen something happen that I thought was very interesting. Something like that happened, I think they were trying to kick the husband out to a family somewhere down south, I want to say years back. And the family called the police
in
in the birth room. And the police responded to the hospital saying that we got a call saying that you're trying to attack this woman who's giving birth. And so it became a fight between the law enforcement and the hospital. And now, mind you, this person is every 2 minutes. I just think as a doula, every 2 minutes we're here. So I know the hospitals. I know the police are here. I know you're take a deep breath.
Right. Because the baby.
Anybody who's had a baby knows you're still in contractions the whole time. Any advocacy shenanigans are going on, which is always so upsetting to me that people do that by themselves. Because if I was there, I'd be holding the space. You know what I mean?
So to that point, when you enlist a doula from the Medi-Cal program, can they do that? Can anyone do that? No. So like, let's just say, so if it's through the program, is that also a means of protection where if you're delivering in a hospital with a doula,
through the program,
theoretically, but practically speaking, a hospital has the ability, like somebody could get on. Now, mind you, in that case, they may actually get in trouble, right? Like what we find is when you follow up on those cases, the person that said, we think is a security risk and we've determined, but I don't know that was the right person. I know that an anesthesiologist can decide who's in the room when they do, like when surgeries are done. I think that they are given that power in a hospital. Most of the anesthesiologists I work with, they were like, well, if everybody's calm and everybody feels comfortable, let's go, right? So I don't know what happened in the scenario that would have them think this is a risk. What I would have done and what we train our doulas often is let's get ahead of these conversations. Let's be like, who is the team? Because when you go into a random hospital on a random Wednesday and give birth with the random people, you don't know their policies, you don't know their protocols, you're not ready for setting yourself up to win for the experience you want to have. But if you know the hospital, if you go on the tour, you talk to the people, you make sure that your doctor has a plan for you, and that's why we do birth plans. Not just I want it to be like this. In any scenario that could happen, I want you to know what I would want.
Wishes.
Right? Yeah. So, it's complicated. And I would love to say that they don't have the right. But there's a difference between, no, we do have a right, but rights are violated.
Yeah, I was going to say, we're in America. So it's like what is legal versus what happens is two different things every day.
And in birth, we're in birth. Whatever's about to happen, we've got 20 minutes for that baby's head to come out. And I, as a doula, want to prioritize, how do we focus on this person having a sacred experience and this baby coming into this world? We about to be in here arguing about whether or not I could be in a room or not.
But that's why it's so disruptive and so amazing and so radical, and why California is such an honor to been a part of creating this benefit, and for the LA County Medi-Cal Doula Hub to exist, and how important it is to fund the doula programs and to create the infrastructure for these programs, and to make sure that Californians and indeed all American citizens have access to doula care, and that we support the advocates and the policymakers, et cetera. Because bottom line is that the doula is representing justice in action. But that justice in action has to be embodied by the birthing family. And so when doulas step into the scene and say, what do you want? And that's amazing, you can get it. Do you know what I mean? That is what transforms how we're going to birth in this country, is remembering our power and remembering our rights and being able to have somebody who protects those rights. And indeed, I think it's really important, the infrastructure that's created, I would say like the spider web, the web of doulas. Because there was another young mother, this is just a month ago, who was giving birth at a LA County hospital. She was unhoused. One of the doulas was charged with supporting her. That doula was in the hospital having a surgery. I didn't know this at the time. And she contacted me and was like, Mama Khefri, there's a woman that she's giving birth and they're going to take away her baby. I said, what do you mean they're going to take away her baby? Hold on, slow down. What's going on? Well, she had a cesarean 2 weeks ago and she was bleeding and she had to go back to the ER, and the ER says they can't admit her. They're going to take the baby. I'm like, well, they're not going to take her baby. Hold on. Let's find out. Text Dr. Sayida, text the hotline, text everybody. We got to figure it out. We got a solution. We need somebody to help support with the baby. All that information went to the doula care universe, the doulaverse. And all these solutions came forth and came right back to that mother.
I love that.
The fact that there was over-policing happening at the time, the fact that they were trying to, I would say, commit an act of violence. When you separate a mother and a child, that's considered an act of violence, really. Even in war states or in quarantines, you're not supposed to separate infants. Even right now in the war states that are happening, where they're taking, and even in immigrants right now that their babies are being taken away from them, absolute disruption of human rights. And so I think that doulas disrupt that. We would disrupt that by placing the power back into the hands of the birthing families. And that's what's so exciting about this benefit and why we need to support the benefit.
Support the benefit, y'all.
Get the benefit, get
the
doula.
benefit, support the benefit.
But also, this is a reminder of like everything that's possible and how we have to educate ourselves on the things that we want, right? Is to have happy, healthy babies. But also what this speaks to for me is community, right? Like for someone to be able to make that call and then you hit up the doulaverse. Like we talk about community and sisterhood a lot on the Mama's Den, but it's also more than sisterhood, right? It's the family,
Yes.
it's the village. It's like we never could, but we cannot afford to just go through life like doing big things like having babies alone. And or being parents, like going through this adulting stuff alone. And the ability to the necessity of building your network of people that you can call, like this whole folks being scared to call folks and ask for help all the time. And I, I'm grateful that I met you, Khefri, when I did. I literally was pregnant, didn't have support out here, and wanted to be in a space where I felt like, okay, I'm going to meet moms that, are pregnant, because prenatal yoga class, like it's that simple. People ask us all the time, like, how do you find mom friends? Go to where they are. And to be able to call you when I needed a Black midwife and could not find one in Los Angeles at that time, like one of the main ones had just moved away, which led me to Kim Durden and to conversations like this. I know that if somebody that I love was having a baby and having some sort of issue right now, any one of us about to call y'all.
Right.
Yeah.
Right.
And everybody deserves that in every city. Like, build your network. Like, we have to be active.
I just want to say this, because as you're talking, Cody, what the major thing that I think about is that my mother was very informed. She grew up on a barn in a farm, so that's like a different intuitive type of woman.
Right.
What I would suggest, I don't know if you guys already do this, but I literally just thought about this. I think the thing is information and the knowing. And a lot of people don't come from families that have that knowing.
That's right.
I think that if you all went to schools, like high schools, in elementary schools, in middle school, I think if you guys visited those schools and started planting that seed in young girls, in young boys' minds, that's actually going to be the difference that it makes. Because to your point, a lot of us don't figure this out until maybe after we have a baby, or just the experience, or you guys were blessed with having a circle, just that alignment, because I believe that was your calling. Absolutely. So I feel like the universe, God, whatever you want to call it, made it happen for you to have that knowing. But I really feel like people just don't know, and their parents are not going to tell them, I was like you. When my friends were having babies, I'm like, are you going to breastfeed? Let me tell you how to breastfeed. You know what you need to eat? Like, I was just like little Miss Erica Badu as a high schooler. Like, what's in your hair? Get that relaxer out. Like, that's just always been me. But I feel like my friends always tell me, like, you were telling me stuff that my own mother wasn't telling me. So me telling my friends this and then their family's not supporting it is because they didn't have that knowing. So I don't know if you already do it, but I suggest that would be a good program
so
to have.
Funders, as you're listening, we actually tried to get DACS to let us have underage doulas. We really fought. We went hard for that, and we lost that.
Okay.
But it's because of the structure. There's a lot of liability, hospitals. They were like, they would love the idea of it. They felt the vision, but the practicality of it is, sending 16-year-olds into a hospital when they actually don't have adult rights, But training young people, and certainly we train our daughters. And
that's what I was saying. Just going to school and doing presentations and teaching them what
they
is a
get
doula.
it. Well, you should understand your reproductive cycle.
Exactly.
You should understand when you're fertile. You should understand when you can get pregnant. You should understand what a cervix is. You should understand what your breasts do and how to nurse a baby. You should understand what perimenopause is. You understand what menopause is and after menopause.
I've been saying I need to teach perimenopause to high school kids.
We do. We need to understand.
So I want to ground us in a few points, and then we want to tell people where to find you. So as we've all learned, like, California took a really important step by covering doula services. And so the next step is to make sure that doulas have the support and infrastructure. Thank you,
You
Melanie.
did it, girl.
Lord Jesus. To sustain the work, right? One of those ways, frontline doula. Tell us where we can support the frontline doula.
Oh my gosh, and Sayida and I will share with you a few of the organizations that you can support, but frontlinedoulas.com is where you can go to support our work. LADoulaHub.com is where you can go to find out more about the LA Doula Hub and doula services. There's many organizations that are listed on our community resources page and our advocacy page, so you'll find a lot of local orgs and national orgs there. My IG is Soul Mama Goddess.
Soul Mama Goddess.
And mama with an A or M? Oh,
yeah,
it's
M-A-M-A.
M-O-M-M-A.
Okay, that's where y'all find Khefri, Soul Mama Goddess.
And Dr. Sayida is Dr. Sayida Uplifts. And Frontline Doulas and Diversity Uplifts are all on IG and Facebook.
Wait, how do you spell your name, Dr. Sayida?
So DrSayida. So at Dr. Sayida, that's at Instagram and Facebook and LinkedIn. DiversityUplifts.org is where you find out about the nonprofit. So Diversity Uplifts is a nonprofit that fiscal sponsors frontline doulas and also is a fiscal sponsor for a number of other Black and people of color organizations around California who do birth work. So we've got a lot. It's a web, as we talk about the doula web, there's a web in Diversity Uplifts where you find more organizations that are in different parts of California to support. And you could also go to my information at Dr. Sayida to find information about trainings that I'll do. Because one of the things that Khefri and I have been a part of, how we actually met each other, is we were doing doula trainings. We were doing supplements to doula trainings, because there's the basic general doula training, but there's also, the sacred goddess, yoga, mindfulness work. There's a mental health stuff, because I'm a psychologist. There's a lot of support that needs to happen for the doulas to be able to support families that have needs that are far greater than doulas maybe typically were supporting, right? And so trauma-informed care, understanding implicit bias, understanding advocacy. You don't want to just jump in front of a doctor in the hospital and tell them, I said you can't do this. That's not your place as a doula to get in front of your client who is their autonomous birth, right? So we really want to be encouraging empowerment of our clients as doulas and in this work so that they are set up to win and there's a lot of support behind them. I wanted to say something too. There was something that came out that I just wanted to correct, because I know that one of the stigmas that comes up around doulas is that people are like, well, I don't want my doula to be fighting with my doctor, or I don't want to have a contentious experience in my birth. The typical day in the life of a doula is in partnership with all of the people who are supporting this person.
And the fathers.
And the fathers, right? Actually, that's a lie. I mean, the fathers love doulas because they're like, oh, now I know what I could do. I could win here. I could be doing the thing that she really wants, but I didn't really know what it was, and she didn't know how to tell me. And so I always love supporting fathers and partners, because the relationships can be really improved with that support. But, in the ideal model, the doula maybe has a chance to meet the midwife or the OB. They may, certainly introduce themselves, and they're in the room. And listen, if you're in a hospital, every 12 hours, a new person's coming in. Your doula is probably going to be there seeing multiple people shifts.
Right.
So your doula actually is the continuity in the hospital system for you, which also then helps a little continuity. I've had the L&D nurses and OBs, if something's going on, I've had them because they've been given permission to talk to me, ask, is there something we're missing? It seems like there's, is there anything? And with the permission of my client, I'm able to share, well, actually, this is a situation, or they really need a trauma-informed experience. You cannot touch them unless you say your name. There was, and encourage them around ways to make sure they get the care they need. So just wanted to share that it's not a naturally contentious environment. Right. It's just a supportive environment for this birthing person with somebody who's going to stay with them when the nurses are coming in and out, when the doctors are coming in and out, when you're at home before you go sometimes, and when you're at home after.
I love that.
Well, Mama's Den fam, we are so grateful to Dr. Sayida Peprah and Khefri Riley, because you guys are making sure that California families, and every family, has access to doulas, midwives, and culturally responsive care. And we clearly know that these models work because we see the benefits of using doulas. And so now we're here to talk about it, to help y'all scale them, and also to make sure that our Mama's Den fam really understands their options, and that they do have to take control. You can't just sit back and just hope it'll be okay.
Yeah.
You got to make it okay.
Thank you,
Thank
guys,
you, ladies,
so
for
much.
coming.
Thank you
so
for coming
much.
here.
I feel like I could just sit and talk to you guys for
I know.
hours.
We'll be
Yes.
Going forever.
Come back.
All right, see y'all Mama's Den folk next week.
Bye.
Bye.